When I said you develop a certain expertise, I was talking not just about ill children, but about children where both the parents and the physician know they're on a futile course and this child will die. And I think that that's one of the most difficult things to manage in surgery. I don't think anybody goes out and seeks to do it, but I had so much experience with cancer in children that I got to the point where dying children were part of my life every day, and I did feel that I had developed a way of putting myself in the parent's position and at least introducing them to my faith. And for example, I frequently would have a family who would be just distraught that I was going to operate on their child, and many of the things I did were innovative things, very risky, but on the other hand, if you're going to die, why not take a risk? And I always would say to them the same thing, Mr. and Mrs. Jones, let me assure you that if I thought that I was walking into that operating room under my own steam, my own power, my own knowledge, and was going to operate upon your child, and its survival depended upon me, I wouldn't open the door. I believe that I am a servant of the Lord and that I'm going in that operating room with gifts that He has given me. But your child is in His hands, and He will guide me, and I will let you know everything that I can about the future of your child. That brings them a tremendous sense of comfort, but it also clears the air as to who says what, and that I am not pounding myself on the back and say, hey, what a great surgeon, I can do this and get it through every time. And so I developed a reputation for being that kind of a person in a tough situation. And when my son died, if you ever have to go through an experience like this, you look for everything you can to wring something good out of that experience. So I said, you know, you think you're an expert in dealing with dying children, now you know what it's like and you'll be ever so much better. Well, to my great surprise, I couldn't even talk to a family without crying. And there's a very funny thing about medicine. You're taught early on, the one thing you never do is break down and cry before a parent. And I don't know what the reason is. I guess it's a sign of weakness. But nevertheless, that's what I did. And I have to give you a little side story about this. I had operated on a little girl at the Children's Hospital. I knew she was going to die eventually, but she lasted about 3 years. And her mother was a Christian, and she was a sweet little girl. And I went and spent the last hour with her. She was alive, and knelt at the side of her bed, and we talked about where she was going in heaven and what it would be like. I said I didn't know, except it was so great I couldn't explain it. She said, but my grandmother will be there, won't she? And so that's the way she died, knowing that she was on the way to see her grandmother. Well, when the grief of that situation had passed, her mother became the director of the gift shop at the Children's Hospital of Philadelphia, and the gift shop didn't sell any books, but they sold one book that my wife and I wrote called Sometimes Mountains Move, which was really the story of the grace of God in our lives at the time of our deepest distress. And I got to the point where she, being a Christian mother who'd gone through the death of a child, and the book being down there, I would send my patients who had a tough future with a child down to see her rather than send them to the social service department, because they were getting Christian advice and somebody who'd been through it. And so it was to that lady I went and I said, you know, I feel so disappointed. I thought the one thing that would happen after David died was that I would be able to really relate to these people, and they would feel it, they'd know it. And I said, all I can do is cry. And I said, I'm a failure. And she said, don't you believe it for a minute. She said, just as you send patients down to see me, she said, a lot come in here that you didn't send. And let me tell you that they figure at this particular time that any doctor who feels the grief enough with them of the loss of their child to cry has to be somebody that they can trust. And so here, through a roundabout way, it was really one of the things that God provided me with, and that is a better way of dealing with people, although it was tougher on me every time than it was on them.